Good morning, everyone. We are here. We would like to welcome you to a new live session from Planet X series. Today, we are having a very special session celebrating in advance the International Women's Day. And we decided to celebrate it Planet X style in partnership with Doctors Without Borders Dubai office. Most of the time, women are exposed to sarcastic questions repeatedly in our communities and in the media, and especially this part of the world. What do women want? Followed by a statement that you have all your rights. But actually, do we? What about the health challenges and needs of women in our region and in the low and middle income countries? Are they all met and answered to? Do media pay attention to crucial matters and essential and sometimes basic health needs of women and raise enough awareness to engage the community stakeholders to make the proper decisions and take the needed action and measures to solve these challenges and meet these needs? This is what we are going to discuss today with our special guests, the inspiring Alexandra Brown, the Medical Communications Coordinator at Doctors Without Borders Australia. Welcome, Alexandra, to Planet X. Glad to have you.
Welcome. Thank you, Ola.
And we have the talented science journalist and passionate gender researcher, Rasha Duidor, the Communications Officer at Musawa Movement. Welcome to Planet X, Rasha.
Welcome, Ola, and happy Women's Day for everyone.
Okay, our first question, tell me, Alexandra, from your vast experience in the field working at Doctors Without Borders with low and middle income countries, can you tell us what do women need?
Women need access to healthcare, and they need access to healthcare that is appropriate for them, that does not have a whole lot of obstacles between them and reaching healthcare. So a lot of women's health needs relate to their sexual and reproductive health. And if you think about sexual and reproductive health, people often think about pregnancy and childbirth. There are other aspects to sexual and reproductive health for women. But in fact, in some parts of the world, pregnancy and childbirth is the most dangerous time in their lives from a health point of view. If they face the risk of death, or they face the risk of illness or disability. And for this reason, maternal mortality, which is dying due to childbirth or pregnancy, is one of the strongest indicators of whether a health system is working or not, and whether women are getting access to the healthcare they need. So we won't only talk about maternal mortality, but it's just to highlight that women have very specific health needs relating to their bodies, and that they can face a lot of obstacles to getting what is, as you suggested in your introduction, Ola, basic and essential healthcare. So I will be talking tonight from the perspective of Médecins Sans Frontieres, Doctors Without Borders, as a medical humanitarian organisation, what we see and the needs that we respond to. But women need access to basic and essential healthcare, and as I said, it needs to be appropriate for them. It needs to be available to them and within the lives that they're living. And there are actually many obstacles to women getting access to basic and essential healthcare in a lot of countries. So that affects also countries in your region and more widely around the world.
Okay, perfect. So back to Russia. Do you think, Russia, that media, especially in our region, the MENA region, for example, have covered the women challenges and needs in health properly or not?
I would say there is pretty stereotyping of women health needs. Like we have some issues that are in focus, but as we all know, there are some issues that are totally ignored or denied in some cases, and are not considered as health issues. If we take the thread from Alexandra talking about sexual and reproductive health, we don't normally include stuff like availability of sanitary pads for girls and women in this regard. This is something that is rarely discussed. Something like sexual violence, something like, of course, FGM, which is widely spread in Egypt and other African countries. Although
you
it is
mean female genital mutilation?
although
in
it
Arabic,
is
الختان. Yes.
although it is there have been many efforts to eradicate the practice, yet we don't discuss it in the media as like a health right or a health issue. We also have, as Alexandra said, lack of accessibility to healthcare and stuff like birth control. It's interesting that it is understood and perceived as a women task rather than the family task. So, I mean, we don't have this kind of awareness that men can also contribute to the issue. We have child marriage where younger kids would have severe problems leading to death, as Alexandra was saying. We don't include the child marriage as a health issue for girls as well. We would rather talk about all the aforementioned issues as like women rights thing, where women rights is considered as a luxury or a luxurious matter. It's not something that that is rooted in like everyone's business or in mainstream movies or ads or articles or stuff like that. So I would say we still need more awareness, more coverage of different aspects of different issues. Like all I have mentioned has still psychological reflections on women. So even we don't talk about somatic and physiological issues, let alone psychology. So we need to discuss both, because it's very obvious that this have severe reflections on women and the family and the children as well. So I think we need we are getting more aware, but we still need more.
We still need more, of course. So Alexandra, I know that Doctors Without Borders are doing a lot of campaigns, especially in the International Women's Day. We need to know a little bit more about these campaigns and the work of Doctors Without Borders in this area.
So this International Women's Day, and we've started a tradition, we started it quite a while back, that's why it's now a tradition, but we always do a deep dive into a women's health issue every year to mark International Women's Day. And it will be something that we feel is very important, that we haven't talked a lot about, something that our medical advisors and our project teams are trying to focus on, trying to expand as care. So this year our topic is actually self-care, which is about enabling women to have access to the tools, the information and the support they need to actually manage some of their healthcare and in that way overcome some of the obstacles. So Rashaduda mentioned contraception. So 1 in 4 women, close to 1 in 4 women in the world does not have access to a modern form of contraception. And that's a huge number. And ideally a woman would have access to that contraception. She needs it, otherwise she can't plan her pregnancies. She also can't limit her pregnancies if she needs to. Now, of course, ideally that would be a family planning conversation with her partner as well. But a woman does need the information and the access to the contraceptive so that she can manage her body and her pregnancies. And now what's available is there is a self-injectable contraceptive. So this is just one example of how that tools are emerging which are very portable, that mean that a woman can, in the case of the self-injectable contraceptive, which we're using in Democratic Republic of Congo as one country, A woman can be shown how to use that self-injectable contraceptive at a health clinic, and then she can go home with a year's quantities, so 4 injections, because they last for 3 months, and she can manage her contraception at home in the privacy of her home. It might mean that she no longer has to travel a distance that is inconvenient for her, a distance that costs her money, a distance that takes her away from looking after her children at home. It might mean that she actually can do that with some privacy because she wants to, because she does want to take that decision herself and not have it controlled by other people. So this year, actually, the theme of self-care is all tied up with women's autonomy and making sure that they have information, so that if the healthcare system, the formal system, has barriers to care, maybe we can overcome some of those barriers by enabling women to look after their health at home with different either tests or devices or medication. So women do really need this agency to look after their own health, to be healthy. That's it, their own agency and their empowerment is really important, because there are too many other factors that really impinge women's access to healthcare, socioeconomic factors, factors of education, gatekeepers, being there in terms of what information and tools they can have.
Okay, I would like, Yani, it's not about the discussion, but we would like to ask our audience to submit their questions in the comments, and our guests will answer them by the end of the session. We will discuss this issue for like 45 minutes, and at the end of the session for 15 minutes, we will respond to your questions. So, Rasha, the question is for you here. With Alexandra said that Doctors Without Borders are trying to raise awareness. They are trying to provide people with safe and comfortable methods to take care of their health in the comfort of their homes. But do you find negative messaging in the media regarding the topics, the health topics for women that Alexandra mentioned?
I want to elaborate on Alexandra's point. This is very important and a very nice and I think would be informative and constructive way to help women, because we have been like several decades repeating all the time, women are like a candle that lights for everyone, and you should take care of the family, you are the core of the family, and all this lustrous things that in fact would reflect on their health and psyche. And now I'm happy that the discourse is changing, and we started talking about having agency and decision making on their lives. So I think this is very important, and especially for women who are cannot read, who are young, talking about child marriage. They cannot make like their own decisions, and like having this kind of specialized kind of assistance from a trustworthy institute like MSF or like any other place. This is very important, and in Egypt we have a good experience, not related to women, but like to fight polio and give the vaccine to children at their homes, because some children wouldn't go to the hospital to take it. So it has been a huge campaign to ensure that everyone takes the vaccine. This was very important and very successful campaign. So getting to the people, to their homes, to their lives, this is very important. And as Alexandra said, women in many times are not making their decisions in something like birth control we would find like the husbands, the in-laws, her family, his family are interfering about how many kids they would have, about getting more kids to get the boy, and stuff like that. So it's important for the women to have this kind of help and support, and also for the media to accentuate and assert this message that women have agency on their bodies, have agency on their lives. They are not like a tool for getting more kids and then nurse them and all the stuff we know. Even if it is a good and very passionate mission in life, okay, but they still have this agency and the right to manage their own bodies, if not their lives. So yeah, this is, I think this is a good initiative, and it if any other initiative in this regard, this, I think, informing women and educating them, this is very important. Yeah.
Of course. So, Alexandra, do you find like resistance from the media to the activities you are doing in the ground for women health? Do you find it challenging in a way? What are the challenges you face when it comes to media covering the campaign, something like the campaign you were talking about?
So every country is different. If you want to talk about women's health, inevitably media in any country is more interested in what's happening in their own country. So, for example, even here in Australia, when we're talking about women's health, Médecins Sans Frontieres, Doctors Without Borders, works in over 70 countries. And people are like, oh, okay, but, we want to hear our story first. They do want to hear about Australia first, or understand how it's relevant. So you do need to speak to the society that you're communicating in and make sure that there is something you can say that is really that entry point for them in their own society. Probably, we don't know yet how our self-care communications package will go yet in Australia, because we're just, ahead of March the 8th. We have actually used some communications, what can I call them? We have developed some communications to bring our audience into the story of self-care, and we actually have reflected on self-care in Australia and what Australians understand of self-care. But I think, on the other hand, telling women's stories, it's amazing how the women that we meet in the communities we work in every year for International Women's Day, and often for other communications packages that MSF creates, women are prepared to tell us those stories. And as women, we want to hear other women's stories. So already that breaks down one barrier of, it doesn't matter whether she's Australian, from an Australian point of view. I'm very happy to hear the story of a Syrian woman, a woman from Zimbabwe, a woman from Iraq. I just want to hear about other women. So we do find that there is a lot of resonance with audiences of women hearing the stories of other women. And, the media does also, they're very interested in storytelling. They're interested in human stories. And there are a lot of human stories you can tell about women and healthcare. I think Rasha Duda would agree with me. We might have to convince the media a little bit more, but there definitely are.
For this question, I would ask Rasha, what are you, as a science journalist, and you are covering like gender matters as well, what are you expecting from institutes, humanitarian international organizations like Doctors Without Borders? What are you expecting from them when they are communicating with you such programs and campaigns?
Yeah, I would first just elaborate on what Alexandra has been saying in her answer about how people perceive the help of and how the media would frame the help that institutes are giving to women. It's sometimes it should be highlighted. It might not be highlighted enough, and this is something that media should look into. I mean, even mainstream media like radio and TV and like very popular newspapers that wouldn't normally publish like extensive health coverage, but even they can do it like as a declaration or as an announcement. The other thing is that we have these concepts sometimes in the media, because the media is not just like stories on websites or newspapers. It's also the how series and how movies would frame social issues, like we have notions like don't get other people to interfere in your marital matters, don't get help from outside, this will ruin your family, and your husband will get upset, and all these things. But what if the women are abused, or what if she has really serious problems? Would she still keep her secrets and do not ask for help? And also the whole thing about like Western aids and so. But I think when women would understand and perceive how this would help them in their lives, they would go for it. I think for media collaboration with institutes like MSF and others, I think we would love to know real life stories they have, and any initiatives that we should cover and elaborate on. This would be very informative for the audience. Although, as Alexandra said, it's very hard to to convince an editor to talk about something that is not catchy, that is not engaging, that is not talking about new plastic surgery that would get women back in time 20 years and so it's not easy. However, because we are having now like more specialized websites, science websites in Arabic, so this paves the way to publish like more serious stuff and more evidence-based and research-based, and something
So
that really
what about the controversial topics, Rasha? Because some of the editors are afraid of talking or assigning like articles about controversial issues for the community. So if for example, Doctors Without Borders having that very controversial campaign, I'm just saying from the top of my mind. So do you find like resistance from your editors or from the media outlets and platforms that they don't want to go there? It's very controversial. People will just attack us for talking, for example, about contraception, because at some point of the time, people were talking about like, no, this is just a gift from God. You can take contraception and run the whole thing, you know?
Yeah.
And it's very controversial back then. So how do you handle this stuff? How do you convince the media platform or an outlet or your editor of such a controversial issue to cover?
I don't. They are either ready or not. I mean, you can just address the right person. I mean, in this regard, something like that, it wouldn't be published in something like a mainstream newspaper or channel or something. I mean, in the Arabic context. However, it can be brought as a controversial issue. Like there is something controversial had happened. I mean, you wouldn't support. You are covering the issue from the point of view that you are just mentioning that there is a campaign, and you would present pros and cons. But I would say in this regard, you should better address independent media outlets. We do have independent media outlets in the region as well. They are not like millions, but we do have that, and they focus on controversial things that others would not put. And they have their audience, and they can you can raise these issues through this kind of media, or from a pure scientific point of view on specific scientific outlets that that would have, like, they are originally in the States or UK, and they have an Arabic version, so you can discuss the issue from pure scientific without the social part, and of course you can add the social part as well. But I think it's not it doesn't worth the time and the effort to go and convince an editor who would have instructions that he couldn't. So you could address, because you have the right person now, so you can address the right person in this regard. Yeah.
Okay. So back to you, Alexandra, about the controversial issues, and how are you handling that kind of thing in at Doctors Without Borders? Have you done something like that in your campaigns? And how was the feedback and the reaction of the people you have offered them that campaign?
So 2 years ago, for International Women's Day, we released a communications package on safe abortion care.
Okay.
And we did that because Médecins Sans Frontieres, Doctors Without Borders was providing safe abortion and knew there was a need for safe abortion care because unsafe abortion is one of the top 5 causes of maternal mortality. I mentioned maternal mortality at the beginning. But an unsafe abortion is also one of the most preventable causes of maternal mortality, because a woman only has an unsafe abortion because she cannot have access to a safe abortion. If you provide a safe abortion, she does not need to go for an unsafe one at the risk of death and disability. Over 22,000 women die each year due to unsafe abortion, but over 7 million are hospitalized each year due to complications of an unsafe abortion. So Médecins Sans Frontieres was committed to providing safe abortion care. We actually felt that the need that we were seeing was greater than we were responding to, than other healthcare organizations or ministries of health were responding to. So we decided we would communicate about how it is actually a medical emergency that a woman needs access to safe abortion care, and this is a need that is not being met. And we decided to communicate about it because we thought it was important. We wanted to stand behind that. We were worried about how people would react. We knew that some people, just the word abortion was something that they would react strongly to. But we wanted to tell the story about how safe abortion is essential healthcare, and it is the only way to solve unsafe abortion. So, apart from the fact that women also need access to contraception, because an unplanned and an unwanted pregnancy is also the result of not having access to contraception. But just to say, so we were very happy with the way, and this was in many countries, how the key messages that we provided about safe abortion care were picked up by the media, were not changed, were not, people took them, they passed on our messages genuinely in the media. Also, at that time, 2 years ago, there were a number of countries in Latin America where there was a lot of contestation of abortion rights. Legislation was being wound back, bigger bans were being brought in. Women were in the streets fighting about this, and the media picked up what we produced in a number of countries in Latin America, even though for them, they might also have thought it was perhaps controversial or might inflame an audience, but they were happy to receive the message about why safe abortion was important. And the only thing I'll add, because really want to hear from Rasha Dudar on this as well, is that even internally for MSF, we were breaking down a few barriers because we're a big organisation, and there were probably a number of people who, because of their area of focus in Médecins Sans Frontieres, didn't know much about safe abortion care, didn't know much about unsafe abortion. And so we broke down some barriers internally about people's knowledge about unsafe abortion and the need for safe abortion care and for family planning. So we actually had it was successful internally and externally for us. And some people reflected that they actually thought that they had almost been sort of censoring the information themselves. They almost worried about the impact more and held back in trying to push it out more. And then they realized afterwards they didn't need to do that. So it's very interesting how in society, but also in healthcare, sometimes it's the people inside the organizations who are already creating a bit of a barrier to access to care because they're sort of saying, oh, well, we can't talk about that. But you do need to talk about the health need and the way to address it. So we were very pleased with the impact that we had with that package.
Okay, so Rasha, يعني abortion, the word itself in our region is يعني a taboo, and it's freaking some people out because they think about abortion as it's something that contradicting religion, for example, and of course the traditions as well. But people sometimes skip that unwanted pregnancies happen due to rape, due to never using contraception methods and stuff like that. So how would you tackle this issue and about the self-abortion campaign that Alexandra was telling us about, how you would tackle it as from a point of view of a journalist?
Well, this issue has different dimensions. As you both said, we have religious dimension, we have social dimension, we have scientific dimension, and the latter is the least discussed, unfortunately. So we would have the first discussion going that it's haram, it's prohibited by religion. And we rarely talk about rape cases. Then we would talk about the social part that some people would love to do anything to get a baby and you are throwing it away. Then the medical part, no one would talk about, and in some rare cases it is covered in some movies and some series in a very negative way that you would go to a very bad clinic with a very bad reputation and a doctor who is corrupt, and you would face endless medical consequences with no elaboration, whether you are in the first trimester or where. So I don't think it is covered in an appropriate and informative way, and even if you don't, I mean, if a woman would know that her pregnancy, she should do abortion for even medical reasons, and it is permissible and it's okay, she will be very afraid, because how it is framed in the media that with endless consequences you'll bleed forever and and stuff like that. So I think we need in the beginning to elaborate the scientific part of it. What is it? How it differs in different cases in different trimesters of pregnancies? How what are the tools and measures that would help a woman to do that? And I think we can, if we open the discussion like a social discussion in the community, and then some people would come and say it's prohibited by religion, and others would say no, it is not. So this kind of discussion and debate, it's healthy. I mean, for everyone to elaborate their point, we can eventually settle on a common ground or not, but we do still have, you will know that we have different opinions, and like we can address the issue from different perspectives from different people, and then the medical part and doctors, I mean specialized people, would say their word that should inform the religious stance, as many other stuff that because religion, you can still do some changes and some reforms, as we know in different things, but this is very sensitive. But I mean, if the medical people who would inform the religious stance, I think this would be, if we came to reach this point, this would be great, and a very healthy outcome of a healthy discussion and debate. But of course, it's very hard to happen. Because I think in the region, in some countries, it is prohibited by law, and the doctors who would do that, they would have problems with the syndicate and stuff like that. So it's not just the discussion and the debate and whether it's religiously permissible or not. It has consequences on their professional career, and even if they are convinced with the issue, and also the reputation. So I think it wouldn't happen now, but it's healthy to start the discussion and see where it would lead us, because discussion is, if it is healthy and everyone has the word, I think it will lead us somewhere. But like denying the issue, denying the need, I don't think this would lead anywhere.
So I would like to address an elephant in the room, because we are from the discussion that is going on around half an hour now. It appears to me that one of the things that women does not have the full authority over their bodies. They have to answer to the community, their families, to the religion, to everything, and they can't actually take over even their own bodies and their own health. So, as a communication coordinator for such a reputable organization like Doctors Without Borders, Alexandra, I would like to hear from you about this. What did you see during your work in the field?
So it is very difficult that women don't have often all the decision-making rights, or they don't have access to the finance to make the trip, or they don't have enough information because they don't have a level of education that makes it easy to understand about their health and how to meet their health needs. So this is an ongoing problem. You mentioned the community. The community can also be, though, enabler for women to have access to healthcare, because women do support other women. And if you can, for example, train community health workers, and they are the women who will meet with other women, visit them door to door, you know, there's an opportunity there for you to provide some healthcare to women and reduce some of those barriers of women going to a hospital. You know, often we say, for example, in Afghanistan and different parts of Afghanistan, it might be difficult for people to travel to healthcare because of conflict and the roads are dangerous. But there can also be certain hesitancy, and this isn't only in Afghanistan, on the part of the family that the woman should be able to labour at home. She doesn't need to go to the hospital yet. And the woman might want to go to the hospital because she needs care, or go to a local health centre, but someone else might be making that decision for her. So it is difficult to give women, that's not something that we can give them, their decision-making rights. But what you can do is talk with people and talk with the community about, have you seen women die in your community because they were not able to get to hospital? Do you want them to die? Do you want to lose your mothers? Do you want to lose your sisters? and talk about how this could be partly overcome by seeking healthcare earlier, allowing the woman to go earlier. We have a hospital in Host, and all the staff are women. So this, most of the treating staff are women. So this helps overcome one of the concerns of a family that the woman is going to be treated by a man. She can actually be treated by a female gynecologist. But some women also want to be treated by women. It's not that their family said you can't be treated by a man. In some situations, and I'm not just talking about Afghanistan, women want to be treated by women. So this is where you start thinking about what is appropriate care, what is the care that the woman wants. And you really have to focus on the patient and center your care around the woman. And if the woman wants to be treated by a woman rather than a man, how can you build women into your health workforce? There's a lot of women already in health workforces around the world, definitely. But, if you allow women more training, then they can have more skills. So there's a lot of things. Yeah, you can negotiate with the community. You can mobilize women in the community to care for other women. But also you do need to say, okay, what is our health system going to look like? What care are we going to provide? Who is going to provide it? And how will that be appropriate for a woman? And how will that be care that she would want to come for? Because she will be treated well, because she will be listened to, because she will not be told she did everything wrong. So there's a lot of areas to work on, both in the health system and in the community. But communities do come on board because other women want to see other women well, their families want to see them well. You just have to talk these things through and understand the common goal of what, a healthy woman, what the benefit is of her to her, of course, to herself and to everyone.
Okay. So, Rasha, I can't see anyone in science journalism as a science journalist and a gender researcher can comment on what I said earlier. And I don't want to sound very negative, but about something that Alexandra said, that women help women and support women. It is really true in our communities, in our region, especially in our region, because sometimes I feel that women are more harsh on women than men, actually. So please let me know, what do you think?
Taking the thread from Alexandra, I would say that stories she was talking about, like if we touch on really impressive stories in the media, whether it's as a reporting or in movies and series, this is very influential, and we have many success stories in this regard, how movies really reflected on the people consciousness and awareness about certain issues. And also when we talk about the personal and psychological aspect of an issue, like even with men, when because answering to your question about whether women would help women, I would say, according to my experience, yeah, I would say women helping women excel in their careers, even accessing health issues, and by taking their kids, I'll take care of your kids and you go and stuff like that. It happens. Sometimes women would harm women, but I mean, from what I have seen, no, it's more they are. We have solidarity, and because we came at a point in our lives that we knew that unless we stand for our rights, no one would care, and this creates solidarity among women. But I have to say that we should as well engage men, and now many women rights organizations are rethinking engaging men in the whole issue of family reform, because ignoring them is leading nowhere, and in many cases, even if you target and address influential men, like for instance doctors or imams or stuff like that, this is very influential tool for them, when they are convinced, they would convince more people, and the snowball goes on. But you should address you should elaborate on emotional stress on women, and tell them, like, discuss with them, and because they have sure seen their sisters, their daughters, anyone in their lives that had this kind of situations, and also to address men's insecurities in these regards, because in many cases men also have their toxic masculinity, they are obligated to abide by a frame that they should be in, and all of that. They do have problems as well, so we should address their problems and engage them, that the family cannot always rely on a single woman, so they should be engaged as well. And I think the media should address stories from the eyes of women, like how it is for a woman to have to not have sanitation in her home, because it would be different from male's perspective. How it is for a woman to anything. I mean, because it's always inspiring and informative if you cover the issue from the eyes of different people who are affected. So it's very interesting to talk about how women, what are their fears. As Alexandra said, I like very much the sentence you said: women are afraid that people would make them wrong, would make them mistaken. It's your fault. It's your fault. And in many cases, women are faulty in every moment in their life. So it's very sad. So perhaps it's time to gradually change that and reassure them and tell them, even if they did something wrong, it can be fixed, and we can take it from there. Yeah.
Okay. So if you would like to send a message to journalists or some journalists or the media at large about communicating women's health challenges and needs, what you would tell them, Alexandra?
That's a good question. So, from the perspective of Médecins Sans Frontieres, again, we really are looking at women who are the most vulnerable. And when I say the most vulnerable, it's because there are particularly, big obstacles to them having access to care. It's because they are living in a conflict-affected area or country like Yemen, or they've been displaced. They might have been pushed by conflict, and they're on the move and they don't have access to healthcare, or they live somewhere very remote and are sort of marginalised because of that. So that is inevitably those are the women's lives that we're trying to highlight and their health needs. And I think, they're what would I say? I really do think that people are interested in, there is a lot of superficial reporting nowadays. There is such a proliferation of science journalism and interest in health. Just general interest in health has exploded. As Rashaduda, you said earlier, unfortunately, sometimes that is skewed to sort of trivial health matters. But there is something there. There are more opportunities now for us to talk about medical humanitarian issues, women's health needs. I think if you can bring it to life through the story of women themselves, then the story becomes even bigger just than the health issue. And it resonates with the people who are doing the reporting. It resonates with the people who are doing the reading. We know how many videos now you see on different sort of news portals. I think let's keep focusing on the human story. In some ways, with COVID-19, the media has covered many more countries in different countries than it normally would. We're starting to understand again how we are all connected, and hopefully that's something we can sort of harness for nations, this sense of common understanding of how people are affected around the world. I haven't given you a very good prescription about how to do this. Rasha Duda might do a better job of this, but that's the best I could come up with.
This is great tips, actually. So, Rasha, tell us, as a science journalist and gender researcher and gender writer as well, what do you need to write about this stuff? What do you need? How would you work on these issues? What do you think that science and health journalists in our region needs to address such topics in a very clear way?
Yeah, I would first second what Alexandra was saying about that we need to personalize the story, like Fatima, who had this, she died. Like someone with the name had died from FGM. Yeah, yes. She's not a number. She's a human being. She has a family. I mean, this is very important. And to tell different personal stories about the same issue, this will help delivering the message in a touching and tangible way. This is one thing. The other thing is, I think, making the story and evidence-based. This is very important, especially in this era where people become more aware of the scientific part of things. I mean, people are not wouldn't accept that you just give them superficial information about a very deep topic. So I think covering and even highlighting new studies and researches about the same issue, this would be very informative for the people. So this is one thing I want to add. The other thing is, yeah, it's a challenging to work to focus on science or gender as a full-time journalist, even a freelance. In our region, because I mean, you should be able to write diversity of stuff. Specialization is very rare, and it's a luxury in this case. However, I wouldn't say it's always negative, because you can always add a science as well as social aspect to the story. And I think we should start addressing controversial issues. Like in one of my articles, I have addressed having contraceptive pills for men. It has been a research that explored the idea of giving men and how effective is that. Of course, it has been in the West, but I mean, giving a social perspective to the story, like asking some men what it would be if it is the case, would you accept that? And I mean, and raise the discussion from here till we get to the point that we have really men contraceptive pills, and then we would have reached a point of discussion, a scientific one, that would where men would understand that it wouldn't reflect on their sexuality, it wouldn't reflect on their health, on their muscles, and it would be more acceptable socially. So it's interesting to raise issues that are controversial gradually, till we it is even it's normal, not a taboo. Even if we didn't reach a point of consensus, even if not all men would accept the contraceptives, but the idea is there, and it is not like very strange and very weird. I think this is important. If you can do that. And also, I think for a science journalist to raise awareness of the people about their main needs and concerns, rather than just going with the trend that might not be very useful for the local people or the regional people in this regard. And I think getting an expert point of view, like getting a doctor to say FGM is very bad, a doctor, not like a women's rights advocate. This would have a stronger impact and a stronger message on the people. And of course, if people can take it to the TV or the mainstream media, this would be great because it will have more impact. But it's not easy for every journalist to do that. But if the time comes, one should be prepared with arguments and experts and also personal stories that would assert their point and make the argument and make the case for women health in a specific issue.
And I think I might just add, sorry, Ola, that
Sure.
you remind me, Rasha, that people want to know if there is a problem, what's being done about it, and what might be a solution to that, or one of the ways that it can be resolved. So you want to tell that story and make it compelling. This year, because we're doing the self-care package, we're talking about ways that women might normally have been able to treat themselves protect themselves from HIV. That might not be a compelling story for everyone, but when you hear about a woman and how she knew she was at risk of HIV and how she heard about the fact that she could actually test at home and know her HIV status, it's wonderful to hear that, one more woman and many more women can actually not protect themselves from HIV, or at least be able to test, know their status. And then if they know their status, they can also have access to pre-exposure prophylaxis. If they're at high risk, they can have access to pre-exposure prophylaxis. But just to say that if there is a health problem and something is being done about it and people are working on it, and there is a way of changing the problem or solving the problem in part, I think telling that story of problem and solution, people are fascinated about how that can be. Of course, if you can tell them something new that they haven't heard about it, new is always a great hook. And then, as Rasha said, you want it to be evidence-based, and then you become a trustworthy source. And we need more trustworthy sources nowadays in the media, for sure.
Yeah, if I might add something about COVID that Alexandra has been saying, the COVID is one issue that reflected how women are less accessible to healthcare, and of course throughout this year, studies and researches has been released, and even in Musawa from a gender based perspective, we had conducted a survey on how women has been impacted by the COVID in the sense that more child marriage had happened, more domestic violence had happened, more care work. They are burdened with more care work. This kind of facts and figures would quantify the problem and make it easier for the reader and for the people to know how women are not equally affected by different issues. We have gendered impacts. Women are more affected by different issues. Health is one of these, and they are seen as less priority. They are less prior. They have less priority in dealing with their health issues. They have to be. They are part of the deal because, like, poor families want to get their daughters wed to get the dowry and fix their financial status. So how women are manipulated and how this would reflect on their health in respective cases like COVID.
Okay, I'm enjoying the discussion so much, but we almost take the whole hour for ourselves. Let's take a couple of questions from our audience, and we have a question from Muhammad Yahya, is a executive editor of Springer Nature, the MENA region. And he is asking, are there countries in the global south that are more open to discussing women's health candidly and support women? And what can other countries do to learn from these examples? So who would like to answer that?
No, I leave it to Alexandra. Yeah. Go ahead.
So that's a difficult question because there are so many countries in what you call the global south. And I'm put a bit on the spot here in terms of, I think, like I gave the example of Latin America 2 years ago with the Safe Abortion Care Package. And abortion was contentious in a number of countries. But it was being talked about in the media. So even if it's being talked about as something contentious, the topic is out there. So you can talk about the other aspects of it. There actually is almost that space for that. You might fear that you're going to be, sort of shouted down, but there is the space for that. It is really hard for me to pick an individual example. I think sometimes, we shouldn't even be looking at this as from a national point of view, because sometimes the health needs are more specific regionally or a sub-region inside a country. Often it does depend on, for example, people who are higher up who are more prepared to talk about something, and attitudes do shift even in government. Sometimes, of course, it helps to have women leaders who are prepared to talk about this. It's quite a hard question to answer, actually. Rasha, do there are any of the countries that you've worked in, do they come to mind?
I just want to add 2 points. One point is I think one of the problems we have in our region, a main problem and a major hurdle in women's rights and women's health is tying many issues to religion. Like we do child marriage to prevent women from doing something bad, and all this FGM the same, and abortion the same. All I mean, many cases would intersect heavily with religion and traditions. I think other countries like Latin America, I don't think they have the same problem. But I would say the good news is that what would really work, I know of an experience in Upper Egypt where people stick to local resources. An organization named Better Life, they wanted to eradicate FGM, and it is heavily rooted in Upper Egypt. So they made something nice. They hired midwives who normally do the FGM to make awareness campaigns to the people in their homes. And they, on the other hand, they gave the midwives like a small amount of money to start a small project. So this way, they used pure local resources, very influential people to talk to the people, trustworthy. They didn't get externals. They didn't get Westerns. I mean, they made it super successful. I think we need these kind of approaches, like participatory approaches, where you see what the community really needs and what would work with them. Not like just I'll give a training everywhere. This is not going to work. You should see every community as individual and as having different characteristics that you should work with. So I think this kind of experiences is very inspirational, and I really like the idea of having specific approaches while using local resources and local people. People would trust their locals, and also health professionals and community leaders and this kind of personnel.
Okay, thank you, Rasha. Thank you, Alexandra, for the response. And we have another question from Alia Hamid. Alia Hamid is the chief editor of Nature Arabic Edition. She is asking, how can we tackle the issue of menstrual cycle and the fact that some women do not feel well while employers do not understand this and consider it irrational reason for taking leave, for instance, or to be less productive. And I think we can measure upon this question about pregnancy, about a lot of other things that women go through health-wise, and people think it's irrational or it is unproductive because of women are less productive because of these stuff. So we can hear from Alexandra and then Russia.
So here it's really something that I can only reflect on what's happening in Australia, because I don't know about the sort of labour conditions in other countries and how employers are addressing women's menstrual health or not. In a situation, it's a difficult conversation to have. If you're in a society where it's a difficult conversation to have, I think that you do need to speak to other women about this, because other women are experiencing the same problem. If you only have men as the employers, that does make it difficult. But if there is a female within the management level who this could be raised with and she could raise it, I think in 2021, there's an argument that you would hope that there would be some awareness of women's health and the needs they have. In Australia, we're relatively lucky that we have quite good sick leave provisions, but then you don't want to take all your sick leave just because you're having, essentially a bad period day. I don't know how closely, if you do need to slow down because you're having a rough day, but you think you can still go to work, maybe there's a way of managing that sort of slower approach to work, but just making it not so visible. I'm not saying hide it, but we do have to work out ways to manage if it's period pain or whatever it is, and there are some ways that it can be managed. So this is part of self-management. How can you manage yourself so that you can either cope, or if you can't, you do take leave. I think there's quite a lot to investigate just in terms of your own management, how you can connect with other women, and then if you do need something to change in your organisation, how you try and do that. But there may be organisations who are already talking about this. When I say organisations, not your office, but others are talking about this issue. So try and get those resources. Maybe there's resources out there that you can get so that you can raise this at work. Those are probably the main things that come to mind.
I think it's important to normalize the issue of menstruation, and not take it as something to be hidden. I think starting from the kids, like when you when you deal with the kids, even in public, and you say, and when you buy sanitary pads and all this kind of stuff, you normalize the whole issue. And on the other hand, you raise important issues that are important for women workforce, like harassment in workplace, like having specific health issues, and also having men having leave for the children. Like we don't have laws for that, but raising the issue is important. So on one hand, raising the issue, and on the other hand, normalize it. And now it's in on social media in our region. Many people would say we are not shy of getting sanitary pads from the pharmacy and all this kind of stuff. I think it's changing via different generations. And if the parents would learn that it's okay to talk about that with the kids, and it's not and to teach their kids that this is not something they should be afraid of or shy of, this would I think after a while this would yield a different response to the whole issue. And of course the scientific based information, like it's not because many men wouldn't know what really happens, and in pregnancy and in delivery and all of that. I think this is very important issues to engage men in this kind of information, and all the community, just to understand, and understanding is the first step. Then we work out other steps. But I think it would be very important, and it would have an impact even on the long term, to raise the issues and speak about the scientific part of it.
I think one of the issues as well is considering some of the health issues and challenges that faces women as a counterproductive measures. And as Rasha said, we need to raise awareness about women health needs, which differs obviously from men needs, and normalize it as much as we can. And I think it will take a little bit longer time to do that, because to change concepts, that will take time. We have.
Can I speak about the counterproductive thing?
Yes.
Because people would always say that women are not as productive as men. They shouldn't deserve the same salary and all this kind of nonsense. But we can counteract this argument by we do have like facts and figures of women working, and of how many households are head by women in different countries and in different regions. So this is an argument that lacks evidence, and because people would say, okay, women would get pregnant, I wouldn't hire them. Women would have we do have a counter argument, and we can get it if it is a really productive and fruitful and scientific based debate. But many of the times this kind of debate is just saying without any kind of backup evidence. Yeah.
Okay, perfect. We have passed our time and we have came to the end of our session. I have a wonderful time with our very special guests, Alexandra Brown, the Medical Communications Coordinator at Doctors Without Borders Australia. It was a pleasure to have you on Planet X, Alexandra.
Thank you so much, Ola. And it was lovely to discuss with you and discuss with Rasha. I learned a lot in the process as well, which I knew I would. So it was a pleasure to sort of step into your world for this webinar.
And many thanks to our very passionate science journalist and gender researcher, Rasha Dawidar, the communications officer at Musawa Movement. Thank you, Rasha, for being here with us today.
Yeah, thank you to Ola and Alexandra. It's always interesting to meet and join hands with people working together for a better world for women and for everyone. Yeah.
And we would like, of course, to thank our partner for this live session, Doctors Without Borders, Dubai office. Thank you for making this session possible. And we would like many thanks to our audience who watched us throughout the session and enriched the discussion with their comments. Have a great day. Thank you again, Alexandra and Rasha, and hopefully we will have another session, because I think this discussion can go on and on for days. Thank you very much.
Thank you.
Have a good day. Bye.
Thank you.
Goodbye.
Bye. Bye.